Bismillahirrahmanirrahim. So today we are discussing the anatomy of spleen. So spleen is the largest lymphoid organ. It is connected to the blood vascular system. The whole of spleen is intraperitoneal. It is covered by peritoneum, and spleen is not the part of alimentary tract, but it drains into the portal venous system. This here you see is a spleen, and it is intraperitoneal. It is covered by peritoneum. Here you see these are the notches in a spleen. Okay, so this is the these are the notches in a spleen. This is the anterior end of a spleen. Okay, this is the anterior or the lateral end of a spleen. This is the posterior or the medial end of a spleen. This is the superior border having notches, and this is the inferior border of a spleen, which is rounded, which does not have any notches. So let me highlight these for you. Okay, so this is the superior border of a spleen. It has notches near the anterior end, and this is the inferior border of a spleen. It is rounded and it does not have any notches. This which I have highlighted in pink is the posterior or the medial end of a spleen. It is rounded. This is the anterior end of a spleen. It is expanded. It is anterior end, or it's also called the lateral end. The posterior end is also called the medial end of a spleen. Okay, now we look at the dimensions of a spleen. Now looking at the dimensions of a spleen, I have written some odd numbers in front of you: 1, 3, 5, 7, 9, 11. So spleen is an organ of odd number. These odd numbers are representing the dimensions of a spleen as following. This one means 1 inch. 1 inch is the thickness of a spleen. The 3 inch is the width of a spleen. The number 5 represent 5 inch, that is the length of a spleen. Okay, the 7 means 7 ounces. The 7 ounce is the weight of a spleen. And this 9 and 11 is representing the extent of a spleen. A spleen lies in between the ribs 9, 10 and 11. So these are the ribs. So we can conclude that a spleen is an organ of odd numbers. A spleen is an organ of odd numbers. These odd numbers are 1, 3, 5, 7, 9, 11. 1 being the thickness, 3 inches the width, 5 inches the length of a spleen, 7 ounce is the weight of a spleen, and a spleen lies between the ribs 9, 10 and 11. Okay, so now we look at the location of a spleen. So talking about the location of a spleen lies mainly in the left hypochondrium and partly in the epigastrium. Here I am drawing to you the 9 regions of abdomen. Okay, these 9 regions of abdomen being the right hypogastrium, left hypogastrium, right lumbar, left lumbar, right iliac fossa, left iliac fossa, epigastrium, umbilical, hypogastrium. Okay. Now spleen is present mainly in the left hypochondrium. The major part of spleen is in the left hypochondrium, and it is only partly present in the epigastrium. These 9 are the regions of abdomen, and when looking in the regions of abdomen, spleen is mainly present in the left hypochondrium and partly in the epigastrium. Now, if we talk if a spleen is palpable or not, what do you say? Is a spleen palpable? No, a spleen is not palpable under normal circumstances. In a healthy person, a spleen is not palpable. But if a spleen enlarges in any medical condition, so its superior border, which I showed to you in this diagram, this superior border of a spleen has notches. In any person, when the spleen enlarges above the left costal margin, so these notches can be felt, can be palpated in an enlarged spleen. Otherwise, the normal spleen is not palpable. Now, if we talk about the location of a spleen, okay, so we also make a point here. Also note the point that spleen is wedge shape. Spleen is wedged between the diaphragm. Spleen is wedged between diaphragm and fundus of stomach. It is wedged between diaphragm and fundus of stomach. Now, so this represent the 9 regions of abdomen, and a spleen is mainly present in the left hypochondrium and partly in the epigastrium. So spleen is basically present in the left side of the abdomen. Now looking at the next diagram, I told you that the spleen is wedged between the diaphragm and the fundus of stomach. So this you are seeing is the fundus of stomach. This is the fundus of stomach. Next part is the body of stomach. This is the pylorus of stomach. So fundus of stomach and in between the diaphragm, between the fundus of stomach and the diaphragm, there lies the spleen. So this you can see is the spleen, its superior border bearing the notches, and this you see this septa, it's not a septa, it is representing the left dome of diaphragm. It's cut, the diaphragm is cut from here and you can only see a trace of it. So in between the fundus of stomach and the left dome of diaphragm, we have the spleen. Now talking about our next diagram, we told you that the spleen lies between the 9th and the 11th rib. So you can see here that spleen is present in between the 9th, 10th and 11th rib, and its normal extent is till the mid-axillary line. It's not extending further more than it. Okay, so now when we talk about the position of spleen, so the position of spleen, if seen, this is spleen. It lies obliquely along the axis of the 10th rib. Here you see that's the 10th rib. Spleen's long axis, it is present between the 9th, 10th and 11th rib, and spleen's long axis lies on the 10th rib. On the 10th rib, the long axis of spleen lies obliquely, making an angle of 45 with the horizontal plane. If we make an angle with the horizontal plane of the spleen, then it makes an angle of 45 degree with the horizontal plane. So now we have discussed the location of a spleen and that it's wedged between diaphragm and fundus of stomach, and we talked about if a spleen is palpable in normal persons. No, spleen is not palpable if it enlarges that much that it passes the left costal margin, then we can palpate the notches in the spleen. Talking about the position of a spleen, its long axis lies on the 10th rib, making an angle of 45 degree with the horizontal plane. Now we will look at the external features of the spleen. Talking about the external features of spleen, here you can see in the atlas that we have two diagrams of spleen. This diagram is representing the visceral surface of spleen and this is showing the diaphragmatic surface of spleen. I told you that spleen is present in between the diaphragm and the fundus of stomach. So this part, this diaphragmatic surface, it is related to the diaphragm and it is separating the spleen from the lungs from the pleura. Okay, this surface is convex and smooth. Diaphragm is not an organ, it's an inspiratory muscle. So when it covers the spleen, so it's not making any impression. So this view on the diaphragmatic surface, we can see that the spleen is smooth and convex. Whereas if we look at the visceral surface, here we see the concavities. Spleen is concave and irregular in its visceral surface. Why? Because it has got 4 impressions of 4 different organs on its visceral surface. This largest concavity you are seeing, okay, this largest concavity you are seeing is for the fundus of stomach. It is the gastric impression. Then here you are seeing the colic impression. Here you are seeing the colic impression of the colon on the spleen. Okay, this impression is of the left kidney, so this is the renal impression. Here you can see a small impression, that is the pancreatic impression for the tail of pancreas. So on the visceral surface, 4 different visceras are making their impressions. That's why the visceral surface is irregular and concave. Now, once again, we are looking at the ends of the spleen. The two extremities of a spleen are its posterior end, which is also called its medial end, or the posterior extremity, or the medial extremity. We can call it extremity as well as an end. This is the anterior extremity or the lateral extremity. Okay, this anterior or lateral extremity is expanded. It's not round, it's expanded, whereas the posterior extremity is not expanded, it is round. When you keep in mind the diagram, you can easily understand these differences. This anterior extremity is expanded, this posterior extremity is rounded. Now talking about the two surfaces of a spleen, this one surface is the visceral surface, which is concave and irregular because it has the impressions of visceras, and the diaphragmatic surface, which is convex and smooth in relation with the diaphragm, separating the spleen from the lungs and from the pleura. Now talking about the 3 borders of a spleen. So this, I told you, is the superior border of a spleen. On this superior border, you can see these notches. These are the notches of a spleen. Okay, in a normal healthy adult, these are not palpable, but if a spleen enlarges, then these notches are palpable. So on the superior border, we have the notches. This is the inferior border of a spleen. This inferior border is rounded and does not bear any notches. This, if you try to focus, here you can see the intermediate border of the spleen. Okay, this you can see the artery entering and the vein leaving the spleen at the hilum. This hilum is present between the superior and the intermediate border of a spleen. Okay, so this gastric impression was present between the superior border and the intermediate border. This renal impression here is present between the intermediate border and the inferior border. This colic impression here was present at the anterior extremity. It was adjoining the anterior extremity, and the pancreatic impression is present between the colic impression and the hilum. So now talking about the external features, the two ends of the spleen are the anterior or lateral end, which is expanded, and the posterior or medial end, which is rounded. See here, the anterior end was expanded and the posterior end was rounded. Next thing, we see the two surfaces. These are being the diaphragmatic surface, which was a smooth and convex, and the visceral surface, which is irregular and concave. See here, the diaphragmatic surface is smooth and convex, whereas the visceral surface is irregular. It's not smooth, it's irregular and concave. And it has 4 impressions: the gastric impression, renal impression, pancreatic impression for the tail of pancreas, and colic impression. Okay, then we look at the 3 borders of a spleen, these being the superior border, intermediate border, and the inferior border. Where are these border in this diagram? This is the superior border bearing the notches. This is the inferior border, which is rounded, and the intermediate border, which is also round and facing towards the right side. Okay. Now we talk about the 2 angles of spleen. These 2 angles are the anterior basal and the posterior basal angles. The anterior basal angle is formed by the junction of the superior border and the anterior end. The superior border and the anterior end, their junction is called the anterior basal border. And the inferior border and anterior border, their junction is called the posterior basal angle. So the anterior basal angle is the junction of superior border and anterior end. The junction of superior border and anterior end is called the anterobasal angle, whereas the posterior basal angle is the junction of inferior border and anterior end of spleen. Okay, now this anterobasal angle is also called the clinical angle. It is also called the clinical angle. Why? Because if any enlargement occur, this is palpable, so this is called the clinical angle of spleen. Talking about the hilum of spleen, the hilum of spleen is present between the superior and the intermediate border of spleen. Here you can see this is the superior border and this is the intermediate border of spleen. In between these two border, here is the hilum of spleen. Okay, so the hilum of spleen, the splenic artery enters the hilum through the hilum. This splenic artery enters into the spleen. This splenic artery is the largest branch of celiac artery, celiac trunk. Okay, the splenic vein is formed at the hilum of the spleen. It leaves the spleen at the hilum. Okay, then it joins the superior mesenteric vein to form the portal vein. Remember, I told you that the spleen is not a part of alimentary tract, but it drains into the portal venous system. And then spleen is supplied by the celiac plexus of nerves only by the sympathetic fibers. Then efferent lymphatics also leaves the hilum. There are no afferent lymphatics entering into the spleen. Now, talking about the functions of spleen, as it is connected to the blood vascular system, it filters the blood. It also performs the function of lymphopoiesis, phagocytosis. It also has a role in immune response, and it is also involved in the synthesis of antibodies. Rest of the topic will be covered in the next video. Till then, thank you so much.